dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about your eye health with Dr. Purak Parikh. Welcome.
Thank you, Yvonne. Very exciting to be here.
We're glad to have you here. Sometimes people get confused, doctor, about the difference between an ophthalmologist, an optometrist, and an optician. Would you kindly explain the difference of the credentials of these different types of specialists out in the area?
Of course, absolutely. That's a very common question, and it can be confusing because the names are so similar. But for instance, I'm an ophthalmologist by training, which means, so I went to undergraduate college. I completed medical school just up the road at Dartmouth Medical School. And then after 4 years of medical school, we, as an ophthalmologist, do a year of kind of general medical training, everything head to toe. And then 3 additional years of specifically what's called a medical residency. And that residency I performed at the University of Pennsylvania in Philadelphia. And even beyond that, I also trained 1 additional year over at the University of Michigan, specifically gaining some extra experiences in corneal, refractive, and cataract surgery. So it is a long road for an ophthalmologist, but in the end, we do it all, you know, from dispensing eyeglasses to treating medical conditions of the eyes and surgical conditions of the eyes. So that's an ophthalmologist. So it's a medical doctor who has specialized in medical and surgical disorders of the eye and tissues around the eye. An optometrist is also an eye doctor. It's someone who has completed 4 years of college, typically with a science background, and then has done 4 years of optometry school, so a doctor of optometry. An optometrist has a scope of practice that is a bit more limited than an ophthalmologist. It does vary from state to state, but they still handle medical conditions of the eyes, glasses, contact lenses, etc. And then the third one that you mentioned, an optician. An optician is someone where if you are going to, with your glasses prescription, if you're going to have your eyeglasses made, you would take that to an optician and they would fit frames and lenses for your eyes to get you the exact right pair of glasses. And whether you require a certificate of training and any specialized credentials does vary state by state for opticians.
And as an ophthalmologist, you begin caring for people's eyes starting with a newborn.
That's right. Yes.
So can you tell us, from newborn to aging, what starts relating to the aging eye, in a sense, from that newborn into young children? And then we'll go into adolescence and straight up.
Sure, yes. So the newborn eye, you know, it's a wonderful thing. It does not have the visual potential that a mature eye does, you know, for an adult. But even from birth, the vision, although it is blurry, it's able to perceive high contrast images. Which is why a lot of times, you know, with baby toys, you will see that they try to stimulate multiple senses at once. So that might be the sense of touch, crinkly textures, the sound, the rattling that you often see, but then also visually, very high contrast patterns often on the baby toys. And then, we have 2 young ones at home, so also we know everything goes in the baby's mouth. So even taste is thrown in there.
Of course.
But as they become older, 2-3 months or so, that's when they start to develop some better hand-eye coordination. And even children as young as that, it's great to try to do things like lift the flap books, and occasionally they might be reaching for things. Although their real sense of depth perception and ability to track objects using both eyes to lock in on something and follow it really develops best as they become more mobile and agile, roughly ages 5 to 8 months or so. As they become more mobile and agile, they really develop those skills well.
I was going to ask, what should a parent look for as far as any differences in that particular progress?
Right. So at home, there are lots of things that can be done. So in terms of stimulating the kiddo, you certainly want to stimulate them visually as much as you can. And a lot of the tried and true baby toys do a really great job of that. The mobile over the crib to have the baby tracking, oftentimes feeding on opposite sides of the baby just to have them used to turning each way and responding to stimuli in each direction can be very helpful. Lift the flap books, like I mentioned, simply rolling a ball, all this really engages the child visually quite a bit. Things to look out for at home is also important to know. So one thing that is quite important is that you definitely want to make sure that both eyes are pointed in the same direction. And if you see, obviously, one eye that seems to be turning out or in, that can be a concern. And the main reason is that that oftentimes is a sign, one way or another, that that one eye that isn't locked straight on whatever the fixation target is not sensing the vision quite as well, either because it's a blurry image or because it's blocked by something, whatever it may be. And for really young children, the visual pathway very much is a use it or lose it sort of thing, because if you don't have that really strong visual development from each eye independently as a kid, later in adolescent years, teenage years, if we try to improve the vision of the eye itself, unfortunately, oftentimes the brain pathways haven't developed in a way to afford the child, good vision down the road. So it's very critical at an early stage if you do notice an eye turning in or out, or just any sign that perhaps one eye is not seeing quite as well, perhaps a droopy eyelid, or even covering one eye, the child might not like it at all. That could be a sign that one eye isn't seeing quite as well, and it does warrant an evaluation by the pediatrician or an ophthalmologist or optometrist.
And what about if there is something hereditary that is in the family line? Are there things that people should be aware of and then, speed up by the time they go to an ophthalmologist?
Absolutely, yes, there absolutely are. So there are certain genetic conditions that can affect the eyes, even in a newborn. There are uncommon things, but things such as retinoblastoma is very hereditary. Which is actually, a growth or a tumor inside the eye, which not only can affect the eyes, but also affect the life of the young child. And then congenital glaucoma can also run in families. There are many, many disorders, unfortunately, that can affect young children, which is why if the parent has a specific known eye condition that does strongly run in the family, we do recommend evaluation, not only with the pediatrician, but then up to the pediatrician whether an ophthalmologist evaluation is warranted as well.
Is that usually the pathway? The child is seen by the pediatrician and then will be referred to the ophthalmologist. Will the pediatrician pick that up?
Yes, fortunately, the pediatricians are really great and doing very good, thorough vision screenings. At each what we call well child check is certainly something that is well within their scope of practice, and they're very, very good at it. And in general, the pediatricians have a very low threshold to consult our opinion if they feel that anything is awry. But each well child check that the pediatrician performs will include a vision check to make sure the child is kind of moving along the milestones appropriately from a visual standpoint.
And as a child ages, before they begin school, what are the things that they're looking at from a visual perspective, environmentally, and things that you want to make sure are going well for them, as well as red flags that parents should be aware of?
Sure, absolutely. So probably the most obvious one is the crossing of the eyes that I had also mentioned, but then also the red reflex of the eyes is also very important, which the pediatrician will check.
What is that?
Yeah, so we all kind of know what the red reflex is, especially from the older cameras when you would snap a photograph and then you get the photo and it looks like everyone has red eyes instead of the beautiful blues and hazels and browns that we normally have. What the reason for that is because the source of the light from the flash is actually exactly where the image is being sensed by the camera, and you're seeing a reflection back of the retina, essentially as a red reflex, when both of those are at the same point. As a result of that, you can really get a sense of how much light is being transmitted into the eye and also what direction the light is coming back at. If there's a big asymmetry, a big difference from one eye to the other, it does really suggest to the pediatrician that either something is blocking the light from coming back, from reflecting off of the retina, or perhaps there is a very, very strong need for glasses in that child, which is resulting in a slight dulling of that, what we call the red reflex.
And regarding glasses,
Yeah.
what should parents do about that?
Right. So That is a really great question because with young children, obviously, before they're verbal especially, or even when they are verbal and younger, they don't know what's normal. So they're not just going to run up to you and tell you that I need glasses, mom or dad.
Right.
But we are, again, fortunate very much to have very, very good, strong vision screening in our country. So the school age vision screening is very, very good and effective at picking up what we call refractive error in young children and adolescents. And refractive error comes in all shapes and sizes and all flavors. You know, a very common question that we get is, what is being nearsighted? What is being farsighted? What is astigmatism?
Can you explain that right now?
Absolutely, I'd be very happy to. So,
what is nearsightedness?
Nearsightedness, it gets confusing with the terminology.
Of course.
But nearsightedness is actually when, if you were to have your glasses off, if someone were nearsighted, they would still see pretty darn well up close, typically. However, way, way out in the distance, it's a bit more blurry, challenging. Yeah. And the reason for that is actually that the optical power of the eye in someone who is nearsighted is actually a little bit too strong. Either the eye is too long, or the shape of the surface of the eye, the cornea, is a little bit too steep. And because the eye is too strong, what you actually require are minus lenses in front of the eye. So someone who is nearsighted might have a glasses prescription of -2, -3, something like that. But fortunately, to see well up close, we need to bring in power anyway, which is why they are able to see well up close, because they have this additional power at the kind of resting state. So that's nearsightedness, myopia, it is called. Farsightedness is kind of the opposite of that, or the inverse of that, in that the resting power of the eye is a little bit too weak, and that the eye needs a little bit more help from a plus-powered lens in order to keep everything in focus. So we call it farsightedness because especially younger children are able to pull in some extra power from the muscle inside their eye, which causes the lens to change its shape and keep things in focus far away. But oftentimes, you know, when things are getting really close, you can tense up that muscle all you want. You can only round it up so much. So they might need reading glasses, or even to see things well out in the distance, they might need glasses as well. So that's someone who would be farsighted, or what we call hyperopic. And then astigmatism is also a very common one. You know, a very common question we get is, what is astigmatism? And what that is that's when the shape of the eye isn't perfectly a sphere or shaped like a basketball, you know, but more similar to a football. So it's steeper in one direction versus another direction. And astigmatism can be present with myopia or nearsightedness. It can be present with hyperopia or farsightedness, or it can be present all on its own. But that results in needing a pair of glasses or contact lenses where the correction is done a certain amount in one direction and a certain amount in the other direction.
Very interesting. How do you know with children, because their communication and their developmental mindset isn't able perhaps to articulate if what you're giving them from a prescription related to glasses is working? How do you assess that?
Yeah, that is a really great question, and it's really an art. So what we're able to do is oftentimes we'll put on something engaging for the child to look at way out in the distance. And then I had mentioned using the red reflex. That will basically allow us to know if the reflex coming back from the eye is coming back straight, which tells us that the child is seeing the image clearly. So by putting lenses in front of the child and seeing what the red reflex is like, it can let us know in an objective way what power lens is going to give them the best vision.
Okay. So as we move up through the years, what can parents do to help their children as they're getting older?
Yeah, so fortunately, vision screenings in schools are very, very effective. Absolutely being sure to have the child seeing the pediatrician regularly for their well child checks, keeping them healthy, you know, a healthy diet, preventing weight gain, childhood obesity, all these things can affect the eyes later.
How?
Well, so certainly diabetes, even in young children, is unfortunately becoming more and more common. And as we'll speak about in a separate segment, we'll talk about how diabetes can affect the eyes. So that would be one certainly very easy way to ensure the health of the eyes, keeping a well-balanced diet as well. But fortunately, most changes in terms of refractive error tend to stabilize by roughly the age of 20 or so, meaning that if a child was wearing glasses or contact lenses at that time, that is a safe time where they could potentially have LASIK or some sort of corrective surgery to improve their vision.
And what is LASIK surgery like?
LASIK is a really great procedure where instead of using glasses in front of the eyes to change the way light is bent, a procedure is done to reshape the surface of the eye, the cornea, and that changes the way light is bent. Essentially treating it like a permanent contact lens on the surface of the eye that you never have to take in or put out because it just changes the shape of the eye.
How do we know if someone is, good for this type of
Yes, a good
surgery,
candidate.
a good candidate?
Right, right. So that's a really good question. That even just simply knowing the numbers of someone's glasses script alone does not tell me 100% if someone is a good candidate for LASIK, but there are a few things that we want to make sure of. One, the glasses script is not changing year to year, which is why typically above the age of 20 or so, folks are at least have to be that old in order to have LASIK. Then in addition to that, it's a common misconception to think that, if you're farsighted or if you have astigmatism, you can't have LASIK. You absolutely can, but it really depends on the amount of all of those things and if the health of the eye is strong enough to undergo any sort of surgery at all of the cornea.
And how does that play out regarding the aging of the eye?
Yes, that's a great question. So within the ages of roughly 20 to 40, about 45 even, the maturity of the eye, the health of the eye is really quite stable. Once we get to about 45 or so, a lot of folks notice, we joke around that their arms are getting longer. They're needing to either put on reading glasses or keep things a bit further away in order to see them well up close. And that actually has to do with what I mentioned before, that the lens inside our eye, which is free floating, right? Well, it's connected by little, almost like trampoline springs, zonules that are suspended in the center of the eye. And that lens, when we're born, it's this crystal clear, really flexible, almost like a ball of jelly that's connected to a muscle. And when that muscle contracts and strengthens, the lens takes on a more round shape and pulls things into focus. But at about the age of 45 or so, that lens starts to stiffen, become less flexible over time. So you can contract that muscle all you want, but it's still not pulling things into focus, which is why we need reading glasses at around that time.
And then what else changes after the 40s into the 50s, 60s, and beyond?
Yeah, so one of the most common things that we see here in New England, we have lovely weather here in New England. We get snow in the winter, we get to hike, we have beautiful summer weather. But the winters can be cold, they can be windy, they can be dry. So we do see a lot of dry eye. And dry eye is something that is relatively underdiagnosed, but it can cause all sorts of symptoms: chronic irritation of the eyes, pain of the eyes, fluctuating blurry vision. And dry eyes, it's almost one of those things where it's somewhat expected to some extent in most people, especially as they become older in life.
And what's the treatment for dry eyes?
So dry eye, we could speak for hours on the treatment of dry eye because we are just in a revolution from an ophthalmology world in terms of having so many options to treat dry eye well. But typically, for the initial treatment, what we recommend are plain old artificial tears that you can get at the drugstore. A very common question that we get, though, is we have these eye drops. How do I put them in safely? And I actually brought an eye drop. Perhaps I could show you
absolutely, that would be fantastic.
my fail-proof method.
Okay.
So this is an artificial tear.
Okay.
When they come in the little individual plastic dropperettes like this, that means they typically don't have any preservatives in them, which is great.
Yeah.
But you certainly want to make sure you have nice, clean hands whenever you're putting in an eye drop, and then taking the cap off. The way I like to do it is, for instance, if I were to put a drop into my right eye, a lot of folks notice that they have some difficulty with kind of having the eyedropper free floating up in the air, and it can be difficult sometimes.
Surely.
So what I like to do is I like to put the dropper in my dominant hand,
Yeah.
and then with my non-dominant hand, I pull down on the lower lid, and then I kind of make it like one unit almost.
Okay.
That way it's not free floating or anything like that. If I move my head, everything moves.
Yes.
And where you really want to aim is for kind of the pocket in between the inside of the eyelid and the white part of the eye. And then I just look up, and then it goes. And
you aimed right for the middle of the eye.
yeah, or really even on the inside of the eyelid is quite all right.
You made that look very easy.
Well, I'm a professional.
But that is a very common thing that people need, and they ask about how
Absolutely.
do you put them in the best way.
And it can be very difficult, as ophthalmologists. second to only geriatrics. We have the oldest patient population, so a lot of our patients have arthritis, maybe have a tremor, so it can be very difficult to put in the eye drops. But if you use two hands and with a little bit of practice, it can very effectively be done. And the other really nice thing is the eye can really only hold one drop at a time, so you don't have to worry too much about putting too many drops in. So if you miss once or twice, or you're not quite sure if it went in, it's okay to put in another drop to make sure it got in there. The other thing that can be helpful is some folks refrigerate their eye drop. And by refrigerating it, you can feel it touch the surface of the eye a little better. And in addition to that, it is just a bit more soothing to the surface of the eye.
So the coldness won't impact the eye at all?
No, it
Not
won't,
at all.
fortunately
So what are
not.
the common things besides eye drops?
So besides eye drops in terms of treating dry eye, the other thing that is very, very common is dry eye coexistent with what is called blepharitis. So we all have oil glands in our eyelids, and those oil glands oftentimes get clogged up. What they normally do is they put out a very thin layer of oil on the surface of the eye, which prevents our tears from evaporating too quickly. As we get older, they can become clogged up essentially, or the composition of those oils can change. Most effective way to treat that is by using some gentle heat and massage, and gently massaging those oil glands to let those contents liquefy and spread out onto the surface of the eye. There are many ways to apply heat to the surface of the eye. This is a specialized type of mask that I have here, and this mask can be just simply put in the microwave, and then it has an elastic band in the back, and you can put that on the surface of the eye to gently heat those oil glands. But sometimes these are hard to find. And the other thing you can do, this is a makeshift warm compress that I made myself. You just simply can take some uncooked rice, put it in a sock, clean sock, tie it off, put it in the microwave, and you've made your own warm compress.
And the rice will cook?
Yeah, then you have a meal. No, I'm kidding. But a lot of folks use, initially try a wet compress that they run under warm water. The difficulty with that is that it becomes cool so quickly, and you end up with this wet mess on the side of your cheek. But using dry heat can be really, really effective for blepharitis, which almost all of us experience at some point or another.
How long in the microwave? Because you wouldn't want to get it too hot on the eyes.
That's correct. That's exactly right. The eye around our skin is extremely thin. Yes. So, with this type of mask or this, oftentimes even 30 seconds works well. It depends on the power of the microwave, but slowly going up from there. Warm enough where you can feel the warmth, but you can comfortably hold it tight without feeling any discomfort or anything like that.
Can you explain what to expect when we see an eye doctor?
Yes, absolutely. So when we go to the eye doctor, I got into ophthalmology. I'm going to segue as I explain this into the reason I got into ophthalmology as well. But I was just astounded by the technology that we have available to us in the clinic. So we have the coolest toys, we can use lasers and ultrasounds, and we have microscopes at our disposal that can give with incredible optics where we can examine the eye perfectly. And all of that is done right in our clinic. So we are very lucky in that we don't often have to send patients to another building, to another hospital to get blood work done, to get x-rays, to get CAT scans. Occasionally that's required, but most often not. As a result of that, though, it's a little bit of a longer visit when you come to see the eye doctor. But what most patients experience, when they come in, is that we check the vision independently in both eyes. We also like to check the eye pressure in both eyes, because the eye pressure really will help us understand the health of the eye, any risk for glaucoma potentially. And then in addition to that, we test the movements of the eyes, how good the peripheral vision is, the function of the optic nerve, and oftentimes we'll dilate the eyes. So with dilation, what happens is the beautiful blue and brown eyes and hazel eyes that we all have, we put eye drops in to temporarily paralyze that muscle and open it up. That allows us to see in great detail the lens of the eye, the retina, and all of the other structures. And we're physically looking at the blood vessels in your body, which is why we're able to sometimes catch early diabetes, hypertension, all sorts of conditions, because we literally have a window on the surface of the eye that we're looking in, and we can see the health of the body. It's quite amazing.
My goodness. Can you summarize the most important information that you would want people to know about ophthalmology and what you do?
Absolutely. So I am humbled every day at work. I really am, because patients are trusting us with their eyes from a medical or a surgical perspective, and they are allowing us to have the opportunity to give them their vision back or preserve their vision. It's a fantastic field. What I would say is that, unfortunately, not all disorders that affect the eyes over time have symptoms, which is why it's just so critical and so important to be able to go to your medical doctor or your pediatrician for a younger child, to routinely see the eye doctor, once a year, even if you don't have the need for glasses, because like I said, we have this ability to look directly into the body and assess the generalized health of the eyes. We are so lucky to have the visual experiences we do every day in this world, and it's really critical to make sure that we are taking good care of our bodies, maintaining a proper weight, eating a balanced diet, getting plenty of exercise in order to preserve the vision that we all have.
It's so important, because what you're saying, and people may not realize, that the eye health is as critical as all of the body health. So it
Right.
integrates all together, and what we do with each of the other parts, and the part of eating, resting, exercise, and all of that, can affect the eyes.
It sure can. It's an organ just like any of the other ones, and yet it's so, even though it's small,
Right.
it is so critical for our daily functions.
And how would someone find an ophthalmologist?
Yeah, so there are plenty of ways. Each state typically has their own medical society, an eye medical society. In fact, I am fortunate enough to be the president-elect of our New Hampshire Eye Society of Physicians and Surgeons. So reaching out to the state society to locate a local ophthalmologist will be very helpful. In addition to that, everyone's primary care doctor typically knows great ophthalmologists, because oftentimes the primary care doctor is working in tandem with the ophthalmologist or optometrist and ensuring that their patients don't have diabetes that is affecting the eyes, high blood pressure, or helping manage them at the time of any potential eye surgery that they
And
might
the
need.
primary care doctor also can refer them to an ophthalmologist if
Exactly.
they're not currently seeing one, too.
That's exactly right.
That's excellent. Well, this has been a very informative program, and we greatly appreciate it. We look forward to the next segment that we will be doing on eye conditions.
That's right.
Thank you
Look
very
forward
much.
to it. Thank you,
Until
Yvonne.
next time.